When you're an individual therapist, your focus, your client is the one person who's sitting in front of you. And so when they come in for the first session, you're basically saying, what do you want? How can I help you? What's going wrong? Because people don't normally show up for therapy when everything's going fantastic. Yeah. Now, the problem in couples therapy is we understand that the client is not the two people sitting in front of you. The client is the relationship, which I kind of conceptualize like a vulnerable child that this couple is often not treating very well. And that's why the relationship is struggling. And so if you ask that question, if you come in with your average couple and you say, what's going wrong? What they're going to start doing is you're going to have the more verbal person saying like, oh my God, they're doing this and they're doing this and they're doing this and they're doing this. And the other person is sitting there thinking, I can't even, I can't believe that I agreed to come in here. This is shit. How soon is the session ending? How can I get out of that? And that's normally going to make their partner more anxious as they see they're not saying anything. They're just being quiet. And so with that single question, which is great in individual therapy, you've set your couples therapy up to go wrong. And so in couples therapy, what we would do is we'd say, what's your goal in terms of coming here? What do you want to achieve by coming here? And often, sometimes people will still start trying to tell you problems because they came in prepped to tell their problems because unconsciously or sometimes consciously, most people are hoping that I'm going to say, poor baby, it's all their fault. And we're going to side and tell your partner that they need to change, which doesn't work. So I ask them, what do you want to achieve? And they'll say stuff, well, I want to feel more connected. I'm like, fantastic. That's a great goal. Well, we switch your mind. What do you want to do? Oh, yeah, I want us to fight less. Fantastic. We want that as well. And what the couple often has this realization of like, oh, my partner actually wants something that's pretty aligned. Because when we're stressed and we're fighting, we don't experience our partner as aligned with us or connected with us. And so then we can say, okay, so what's happening between the two of you that's making things go wrong? And then we can break down the pattern of interaction that is creating the dynamic that's going wrong. And so just by that little shift, which is pretty simple to train someone how to do, you're going to get a really different outcome in therapy. And the couple is still going to get caught in that dynamic, complaining and getting defensive and all of those predictable patterns that set up a fight. But again, as a couples therapist, we're saying like, hang on a sec, is this what you're doing now? Is this making the connection better? I like looking at each other and I'm like, no. I'm like, okay, so let's make it better. And so we help them to get out of that kind of fighting pattern and move into a process of being more collaborative, being more connected, the kind of skills that we were using in the honeymoon, where something went wrong. We go, hey, babe, like it really hurt my feelings when this happened. And our partner's like, oh, I'm so sorry. Like I didn't mean to make you feel bad. How do we make this better? So we're not, we send stuff gently. We receive what our partner's sharing with care, we assure them that we're on their side and we make things better. And so what you're going to see then is people often in the first session was like, wow, I thought this would be way worse. I thought it would be much more difficult. There'd be lots of conflict. And I was like, this was nice. This felt really loving. Like it was vulnerable and it felt a bit hard and I felt sad at some point in time, but I feel like my partner's on their side. And in many cases, we're normally seeing that in the first session. They're not going to, in most cases, fix it in one session, but there's a sense of, okay, we're working towards progress and we can make it. And so that just helps hope arise.